So, Carl, if you could start recording, please. Thank you.
It should be recording now. Lovely.
Yeah, it is. Thank you.
Should I?
All yours.
Yeah, thank you so much.
Yeah.
I'm very happy to meet with everyone, and I'm most grateful, Professor Friston, for your help. And also, I'm happy to see that Daniel and Lance are here. So I will then proceed to the presentation. Can you see the slides, Miguel?
Yeah. We can see that.
All right. So it's a joint effort, and it's a diverse team. We have Michael Levin, Chris Fields, who don't need any introduction, and Lance is here, and Daniel, and also we have Rachel Murphy and David Pincus. So the team that worked on this paper has 3 clinicians: Rachel, David, and myself. We have a biologist, a physicist, and specialists in mathematics, entomology, and active inference. So I'm very happy to be a part of this team. This is the preprint for the paper that is currently in peer review. And before we start, I wanted to maybe give some of you an illustration of what we're talking about. This is not the patient's account because we're not allowed to share that. This is a poem from Kurt Weill and his song Pretty Pumpkin, as cited by Paul Molyneux. He's a specialist in DID in England. I woke up this morning, didn't recognize the man in the mirror. Then I laughed and I said, "Oh, silly me, that's just me." Then I proceeded to brush some stranger's teeth, but they were my teeth, and I was weightless, just quivering like some leaf come in the window of a restroom. This is a very poetic text, but individuals with DID recognize some parts of it, particularly the sensation of weightlessness. And I'm trying to maybe stay kind of subjective phenomenological and give us a feel of what we're talking about. Dissociation has many flavors and scales, but the 2 common symptoms that we see clinically are derealization and depersonalization. And very roughly, derealization is a sensation that something with the world around me is very unfamiliar. And it's not kind of losing in oneself in thoughts necessarily, but in extreme cases it could be a scary sensation that suddenly the world is like a fog or very, very unrecognizable. But it can also be mild and benign. And depersonalization is in more extreme cases really is this me? And not philosophically, who am I in life, but viscerally, is that my body? Like an out-of-body experience would be an extreme case of depersonalization. And there's also dissociative amnesias and other factors that participate in this phenomena. But we wanted to say that they're not bright line categories, dissociations. They range from mild to severe. They can be transient or chronic, benign and pathological. So they are indeed a spectrum, not a category. Most of us on this call perhaps experienced mild forms of it. The etiology of pathological dissociations are variable, and most often what we see with dissociative disorders is different kinds of psychological trauma, but also individuals can dissociate when they have neurological conditions or traumas, substance use, seizures, anesthesia, and sleep phases. And we have this concept called dissociative disorders, including perhaps dissociative identity disorder. These are circumstances when dissociations are chronic, and they cause clinically significant loss of functioning or distress. And typically, in vast majority of patients with these conditions, we see history of what we call complex trauma. Complex trauma is different from acute single kind of episode. It's typically a prolonged exposure to stress beyond ability to manage it, accompanied by perhaps repeated traumatic experiences in circumstances where a person has no escape. These are very sad cases. One of the longitudinal studies by traumatologist and DID specialist Frank Putnam, who's very well respected in the field, includes girls who were sexually abused around age 6 or 7 in the family by a family member. So these are very sad cases. And why this paper matters is not necessarily for abstract theoretical exercise, but the problem in the field is that these are indeed quite prevalent. Perhaps their lifetime prevalence exceeds bipolar disorder and obsessive compulsive disorder, but there's continued debates on the field. We have colleagues who deny the existence of these conditions. And for multiple reasons, these conditions are hard to diagnose and hard to treat. And these patients are at a significant risk of self-harm. Just to give you a little bit of illustration, about 67% of individuals with dissociative disorders have repeated history of suicide attempts. Clinically, the highest predictor of completed suicide is the previous attempt. And when there's multiple attempts, that's a very significant risk factor. So these are high-risk cases. And the question may be, and on average, these patients go without the getting diagnosis of a dissociative disorder, sometimes 5 to 12 years. And this is sort of unusual for the medics specifically. But one of the reasons for that, we think, is that there isn't a unified model of dissociations. We have kind of ships in the night. We have neurobiological theories such as cortical limbic inhibition. We have different attempts to model it from first principles. We have various clinical theories such as psychoanalytic ones, etc. But there isn't anything that sort of ties things together. And we don't claim that we provide a model of all dissociations, but we would like to highlight just one aspect of all dissociative episodes, which we call temporal depth collapse. And we examine it from, indeed, multiple theoretical perspectives, including Michael Levin's TAME, Technological Approach to Mind Everywhere, Free Energy Principle / Act Inference, Nonlinear Dynamical Systems, Neurobiology, and Clinical Experience, all of which seems to support the main thesis of our paper. And so we don't claim to clarify that temporal depth collapse is the only or the main cause of dissociations. What we claim is that it is a common pathway. You can have substance use, you can have neurological conditions, you can have psychological traumas that initiate the cascade, and it will go through temporal depth collapse, and it will result in a dissociation. And hopefully this ability to focus on this one aspect of variable dissociative episodes would possibly allow us to develop more accurate diagnosis and higher efficacy therapeutics. So various colleagues mentioned that temporal depth is related to dissociations. Dean and Anna Sionica, if I pronounce her name correctly, Frank Putnam mentioned that. And the relationship error may be different. Some, like Frank, is of the opinion that dissociations lead to the temporal depth collapse, but they're caused by something else. What we're trying to say is beyond that, we're claiming causal structure. We're saying that temporal depth collapse is necessary and sufficient for a dissociative episode of any kind, meaning that if there is a temporal depth collapse, it will lead to a dissociation. And if you have a dissociation, then you must have a collapse of the temporal depth. For those of you who may not have seen this paper, it's long, it's 40-something pages, Technological Approach to Mind Everywhere by Michael Levin in 2022. We find it very useful for psychology and psychiatry and clinical work. And just briefly, there are a few, as Michael calls them, core tenets. One is avoidance of bright line categories, commitment to spectrum, commitment to continuous variables, including intelligences, as opposed to saying this system is unconscious and that one is conscious, this is unintelligent and this is intelligent. We strongly believe that they are spectrum. Then material independence. Michael talks about very diverse intelligences from, biological systems to chimeras and anthrobots and xenobots and in silico systems, all of which are to some degree intelligent. Selves are dynamic in this model and not fixed, and the substrates of selves can remodel radically during their lifetime, which is important for this paper and this talk. They can be nested and overlapping, cooperating and competing both laterally and across scales. And this is a picture from his paper where, the concept that you're probably all familiar with of a light cone is introduced. And you can see different creatures, a tick, a dog, an ant colony, and human beings. The vertical axis is the time and the horizontal is the space. And indeed, ticks, they operate pretty much in the immediate environment and they don't land very far away. The dogs are a little more advanced in that department. And, human beings are capable of planning things that happen after our death and we can recall with the help of culture and language things that happened before our birth. And we can worry about things across the Atlantic. So right now we're meeting across the Atlantic. I'm in the States in Washington, D.C. Which is not to say that we constantly operate in that regime of a large light cone. It contracts and expands, but we're capable of that, while TIC is not. There's certainly a perspective on the same exact phenomenon in FEP. This is a citation from Professor Frist in your paper with colleagues. Temporal depth can be described under FEP as the length of the temporal horizon that is considered during planning, where planning entails counterfactually evaluating the consequences of future courses of action. And maybe a brief illustration from this wonderful paper by Casper Hesp and colleagues, Deeply Felt Affect, of perhaps the simplest, introduction of temporal depth. And this is not their entire model. These are beginning, building blocks. And you can see that at M2, you have 3 hidden states, S1, S2, and S3, that are separated in time. And you can see transition matrices. And then the posterior overhidden states would depend not only on current observations, but also the past and the present, and the transition matrices will be included in the calculation. And this depth can vary. You could have 5 states and 4 transition matrices, and as you can see here, 3 states and 2 transition matrices. So we don't know for sure. This is a question perhaps to Professor Friston, but Lance was very kind to help me identify that possibly the complete temporal depth collapse may mean that B matrices turn into identity matrices with 1s on the diagonal and 0s elsewhere, while a constriction of the temporal depth may be a shift from perhaps 4 transition matrices and 5 states to 3 states and 2 matrices, which could possibly be structure learning or Bayesian model reduction. So we don't know for sure, but we are wondering. That's an open question of what it would look like in the model. To go back to our paper, while we will be talking about humans and mammals, where central nervous system and other components will be prevalent, our model is information theoretic and statistical, so it is material independent. And we do say specifically that the self depends on the organism's ability to infer. So whatever components we need to be able to infer, such as memory systems, are vital. And somewhat loose definitions, to illustrate the 2 symptoms clinically that I mentioned descriptively earlier. So we will say that organisms' belief about the world, about the external environment, inferences about the external environment, the beliefs about the world are the inferences about the external environment. And if there are issues in that process of inferring about external environment, we will call a continuum of such issues derealization. And the organism's belief about its own internal milieu, including its body and mind, we will call the self. And the continuum of issues in this process we will call depersonalization. I will say more here. We will consider self to be hierarchical, composite, nested, and with boundaries. So which makes it, a dynamic hierarchical generative model. And we would like to highlight, which is something that Lance helped me pay attention to, that it's not only the precisions that will dynamically change in this model, but also the structure. And perhaps trivial for this audience, but we want to say that self is informationally separated from its external environment by a boundary, a Markov blanket, making it conditionally independent from not self, not me. And I would like to highlight that the boundary is not material like skin or blood-brain barrier. It is an informational boundary. So to emphasize, the self as we define it is a model, which is distinct from the organism itself. The organism constructs the model and implements it. So self is quite literally the construction of the mind. To illustrate that, this is Michael Levin's, I suppose, doctoral dissertation, where he was working with duck embryos. And you can see blastoderm here, which is a collection of thousands of cells that will have a potential to become a duck. And if you do nothing, then, the top left, you see how it turns into this, green shrimpy looking thing, which is a single duck. But if you introduce wounds in that blastoderm with a scalpel or something else, and the wounds heal properly, then the same exact collection of cells may turn out to be 3 different duckies, the red, the yellow, and the green. And that's very interesting because, you can see that it's not the hardware on what is me and what is not me, and where's the boundary between me and not me. And you can see that it's computed depending on circumstances dynamically. In our model, again, we assert hierarchical, composite, and nested structure. So, and different components of the self will be separated from each other by their own boundaries, their own Markov blankets. And there will be a core of the hierarchy, which we will call the core self. It's also not monadic, it has some components, but for the purpose of this talk, we'll just call it the core self. Mark Solms, I think, perhaps with Professor Friston, likes the onion metaphor. And so then you can see it as the core of the onion, right? Now, the core self, we are borrowing from Jaak Panksepp and Mark Solms. It's a non-reflexive and dominated by raw affective feelings part. That is a component of the core form of consciousness. And these are affective homeostatic mechanisms that allow an animal to problem solve in uncertain, novel, truly novel environments, such as if have, an organism finds itself in a room full of carbon monoxide, and it really doesn't know what to do. It has no priors and no idea of what to do. But by having a feeling of air hunger, it can try things, and it can move a little bit to the left and find out that it feels worse in that specific way, which is not thirst and not cold, but air hunger. And if it moves to the right, it may feel a little bit better because there's a draft from underneath the door. And this ability, this presence of this mechanism increases survival chances and adaptation to environment, and it is indeed effective. So the collection of these core survival necessary affects, including thirst and food hunger and fear and other systems, is the core self. Therefore, the predictions of the core self that all life-sustaining affects will be at or near their settling points, which corresponds to the minimum of the variational free energy, a biologically optimal state. And the activation of one of these affects will be a departure from the VFE minimum, which is a prediction error accompanied by negative feelings. And there can be different kinds of departure, depending on what specifically. They're qualitatively different, as Mark Solms highlights, and you cannot fulfill hunger for food with water. So in mammals, now we're lending our information theoretic models to a specific biological case. We're talking about upper brainstem structures, including reticular activating systems, periaqueductal gray, and they mediate the functioning of the core self. They arouse the brain. They provide generalized arousal, without which nothing else happens. And therefore, if you have these sad and very rare cases of hydrancephalic human children who have no cortex whatsoever, then they do have the core self present, but not the peripheral forms of self, and in decorticated cats as well. So the core self does not require a functional neocortex. And when we talk about the higher levels of consciousness and higher levels of self, then perhaps that's the ability for me to say, I feel fear right now, then that does require a neocortex. And this, in the spirit of the onion, will be called extended consciousness. And there is indeed an asymmetry where the core self can exist without the higher levels, without the extended selves, but not the other way around. Peripheral self components cannot exist with a core self dysfunctional. In addition to this sort of rather extreme form of one component being completely out, we can say that the core self influences the functioning of the peripheral self components through generalized arousal. And we can illustrate that with perhaps phases of sleep and alertness, and the state of the neocortex varying from perhaps delta in deep sleep to high gamma in wakefulness, all of which happens with the help of generalized arousal. Now, if we at the core self level, there is no objects. It's just sort of hungry. It's like blood sugar low, right? But with the help of extended consciousness, we can bind, and I'm citing Mark Solms, a feeling to an object, such as I want an apple. And similarly, we can have recursive processes such as reflection on ourselves, such as I look pale or I am a pessimist. All of which will require the higher levels, the extended consciousness and extended peripheral levels of the self. But what follows from here is that the I that we're well familiar with in our lives is a metacognitive construct, an abstraction that only exists at the higher levels of the self, such as autobiographical self. It is not used or needed in the core self. The core self as a system has the capacity to detect the effective prediction errors and attempt to minimize the variational free energy without any I whatsoever. To talk about the peripheral self components, we will not mention all of them, but only some. There's an autobiographical self, which is a system dynamically representing our life's history, and it relies on declarative memory, including episodic and semantic memory in humans. There is a bodily self, which is a system dynamically building inferences about our body, including various representations and re-representations of the bodily components, interoceptive processing. And just to illustrate that all of these things are hierarchical, then there can be a subcomponent of the bodily self, which is my arm. And there's a social self, which is a system representing our inferences about how we are seen by others and how we present ourselves and act in the social environment. And again, each of these components have its own Markov blanket, separating it from the core, and the subcomponents will have their own blankets. The core is also not monadic, but that's another story. Here's a very interesting observation that goes back to Immanuel Kant and philosophy, and a long-term statement that our consciousness has the property of unity. Even my perceptual experience in the moment right now, I don't perceive talking to you all and seeing the presentation and the sun outside a separate thing. It's tied together in my mind as one episode, as one experience. But generally, I also feel as the same person that I have been yesterday, and I predict to be the same Alexey tomorrow. So what we are saying is that the peripheral levels of the self, such as the autobiographical self, create an impression of a unified experience. And this is not the experience of the entire system. So then the autobiographical self claims to itself and others to be the entire self, while it isn't. And it is that part that is deluded in terms of Anil Seth and believes its own reports. So to reiterate, a stable belief I am whole in the autobiographical self's generative model contributes to us feeling as a monadic self. And so it's subjectively perceived unity, the coherence of the autobiographical self, that is an inference. And a related term to coherence is continuity. I think Professor Friston likes this term a lot, near-Lizard tautology, so I'll say that also. Near-Lizard tautology, stemming from the definition of Markov blanket, the self will remain the same, which is persistent time, while all the processes or communications across its Markov blanket remain informationally functional. We cannot have continuity of the thing without the boundary, and that boundary allows us to persist in time. A related concept here is this question of recognition or misrecognition. If we talk about depersonalization, suddenly not recognizing myself as the same body, is this my body? It is kind of a jamais vu type of experience where, something that is supposed to be familiar is suddenly very foreign, very novel. And indeed, the person who coined the term dissociation studied déjà vu and jamais vu. So, but we would like to say that these calculations of, yes, it is familiar, I recognize this person, or I recognize myself, or, this is completely foreign to me, I've never seen this before, are actually probabilistic and spectrum type phenomena, but we coarse grain them at the higher levels of consciousness into binary and just saying, familiar, not familiar. And is the sound working? Can you hear me okay and see the slides?
Yeah.
Great, thank you. So the changes in temporal depth can be voluntary and healthy, and they can be involuntary and pathological. So typically all of us are able to voluntarily expand or contract temporal depth through attentional control and other mechanisms. You see here a picture of Lars, who is a sailor, or I don't know, mariner, the proper term in England, what would it be, yachtsman. And I believe I'm a very novice sailor, that it's nearly impossible to do long-term planning when you're in a boat. You have to look at the tides and look at the wind and the changes in the wind. and look at other boats, make sure you don't capsize. So you're in the moment. It's sort of meditative experience, and Lars also teaches meditation. But these things like rock climbing and meditation are the voluntary and healthy contractions of the temporal depth. We return back to the here and now. And paradoxically, in the healing, in different kinds of therapy and in meditation, people use this sort of healthy kind of dissociations to help in pathological conditions. But this is just only one small component of what we do in therapy, not the entire story. But involuntary collapses of the temporal depth are pathological, and they indicate the dysfunction sometimes of the underlying memory systems leading to dissociations. At the risk of being trivial, I'll say that representational capacity is necessary. To quote from the textbook by Thomas Parr, Giovanni Pizzolo, and Professor Friston, hierarchical or deep generative model implies that the agent is capable of planning into the future, which in turn requires an ability to generate, store, and retrieve counterfactual data. Generate, store, and retrieve is the description of memory. So when there's issues with a memory, then we may experience depersonalization. And there's different kinds of memory that can be impaired in different ways. And an issue with working memory may lead to one kind of dissociation. An issue with episodic memory may lead to another. And specifically about episodic memories in humans and in mammals, including rats, we talk about episodic memories as contextual and integrated. This is who, what, where, when, and a phobic memory is nothing like that. It's very raw. It's like, a stimulus fear, right? But, episode is indeed where a lot of things come together in an integrated way, and it is context aware. And in perhaps the Casper House paper with colleagues, deeply felt affect, there's a simulated rat in a tea maze. It will have episodic memories such as, I've been on the left before and food was there is a kind of episodic memory. So these are necessarily personal experience. They're my episodic memories. There's a sense of ownership, which can fragment. And affective state and the stress state is important for them. We tend to encode in a more stable fashion mildly elevated stress circumstances, but not too much. Trauma is a different story here. Things that are completely benign, like coffee cups, they're less stable. And the network that provides this functionality is complex, but it usually includes hippocampus bilaterally, the left and the right one. There are different kinds of episodic memories. We know about the process of consolidation and reconsolidation of these memories, which are chemically, anatomically, and functionally distinct. And the disruptions in that process may be episodic amnesias of different kinds, which is difficulty to learn from personal experience. And in the deeply felt affect paper, this could be seen as a precursor, not a full episodic memory just yet. This is levels M3 and M4, where the gamma shows up. The confidence in my generative model, which is how am I doing in this particular context? I may be wrong, but I think it's domain specific. And sort of subjective fitness, the confidence in the fit of my action model to the environment. And it has been proposed by colleagues, including Casper, that gamma has been hypothesized to be related to dopamine. And, we have the E here, which is perhaps habits, and we have the phenotypical goals, which is the C, but the gamma here is related to the G. And in this levels, M3 and M4, gamma is updated based on experiences, not modulated from the top. But if we take it a step further and look at the full model in the deeply felt affect, then here, this is domain general, which is what is the feeling? How am I doing? How is gamma changing with time? Is it going up? Is it going down? And we can anticipate the gamma changes and we can modulate it from the top, which is important. And we think that this is quite close, perhaps maybe not the entire model of episodic memory, but it is indeed contextual learning with affect, which is very close to what we call episodic memory. And here at the top, there's B2 matrices, transition matrices between the affective states and contextual states, which is different from the low-level B1 matrices. And then, Casper mentioned that if we wipe out the orange level, the top, then the agent would turn into a frequentist, which means it loses the ability to learn from context. This is sort of a form of episodic amnesia, right? And again, to go back into what is the temporal depth, collapse or contraction, we think that it's the top B matrices here, the B2 ones, that if they are turning into identity matrices, that's a total collapse. And if they contract to less states and less matrices, then that's possibly a contraction of the temporal depth at the higher level. Now, valence is explicitly present in that paper, where negatively valent states lead to behavior suggesting a reduced reliance on prior expectations, while positively valent states appear to increase the reliance on prior expectation. And what we desperately need for our work, in addition to valence, is arousal. And here I'm borrowing from Mark Solms, or citing, and Mark writes in his book, Hidden Spring, that the more hypotheses are confirmed, the more confident you are and less aroused, less conscious you need to be. You can automatize your action sequences and drift off into default mode. But if you find yourself in an unexpected situation, one in which your predictive model appears to shed no reliable light, the consequences of your actions become highly salient, and you switch out of autopilot and become hyper-aware. The midbrain decision triangle carefully adjusts your predictions as you feel your way through the consequences. And I've illustrated it earlier with the air hunger episode of suddenly, unexpectedly be in a room full of carbon monoxide. So then the negative affective valence will lead to high arousal, lower confidence in beliefs, and positive affective valence may lead to lower arousal and higher confidence in beliefs. Now, we don't know yet, and this is a question also to Professor Friston, but empirically we know that higher levels of arousal means that the agent is more alert to sensory stimuli, perhaps that would be A1 matrices, is more motorically active. We'll talk about that a little bit later, but we think we need to add a bias against movement to the deeply felt affect paper, where that agent and deeply felt affect will actually move if all paths are the same and try to find out more. But we are moving towards sort of learned helplessness, where we would like to change the model such that when all paths are the same pragmatically and epistemically, the agent doesn't do anything. It just stays put because it's hopeless and he knows nothing good's going to happen, so why move? But we think that arousal should change that. The elevation of arousal should start making the agent move. And so more alert to sensory stimuli, more motorically active, more reactive emotionally, which could be the precision of the B2 matrices, and also more confident in the consequences of its actions, could be the B1 matrices. But the important part is the modulation of all of that top down. And perhaps this paper by Lars and colleagues shows how that can be done, where various matrices simultaneously or not can be modulated from the top. We're not exactly sure this is quite there about arousal monitoring, but that's where we want to get. Now, to move on to nonlinear dynamical systems, if we look at the autobiographical self, that I am me, the same Alexey, that has been yesterday and I predict to be the same. This can be described as a point attractor regime, where the basin of the attractor is the minimum variational free energy minimum. The attractor, and the basin is the states near the attractor, right? And that's a fairly stable mode. Now, it will remain stable unless something happens. And what we think is that when trauma happens, if you wish, an affective storm, this is an influx of high level of energy to this stable regime, which can change it. And before it settles into something else, if energy is applied, then we can move from this stable regime to a temporarily chaotic regime. And that's a destabilization of I am me by trauma. And moving on from this stable regime to chaos is a phase transition. Now, the important thing is, from this temporally destabilized chaotic regime of sort of adjusting to trauma, the system can settle into various components, and they're not the same. DID is one of the possible options, but there can be other ones, right? And sometimes we think that the system settles down into this, which is a model, and we're not exactly sure, but this is one of the possibilities that what Kelso and colleagues call a multi-stable regime, where you have multiple minima of variational free energy, and there are repeller regions between them, all of which is surrounded by the global minimum. So again, we move from chaoticity to this. And then you can clinically call it an onset of DID. This is when this condition takes root, so to speak. And of course, it will not be instantaneous. It will take some time. And then these local minima can be seen as alters. And a transition from one alter to another is indeed a transition, right? So you can then see some itinerancy where, the system shifts from Jane to Peter to John. And in a way, then our self is fragmented. And importantly, in terms of light cone, then we can see that the larger light cone corresponding to this has fragmented into a collection of smaller light cones that are here, and that is a disruption of the temporal depth. Now, we don't know for sure, but Lance mentioned this wonderful paper that he wrote with you, Professor Frist, and other colleagues, possible principles of aligned structure learning agents. And here there is a expansion and contraction of the model in structure learning. So we're wondering about fragmentation of the model in addition to expansion and contraction. And the interesting caveat here is that it may not be energy optimal to fragment the model. Again, we're talking about pathogenic states where external energy has been applied. If you wish, maybe the gradient flow increased and it's destabilizing the model, which may lead to fragmentation as a pathological state. Now, what happens if we try to help, in therapy or otherwise? And, be naive to expect with full-on DID, there's this idea in the air that we lead to full integration and back to like I am me sometimes. But the reality is such, sadly, that, the patients themselves are resistant to reintegration and it's dangerous to them. It's painful. So as Frank Putnam teaches us, that sometimes we hope for some better harmony between the alters, or at least communication between them. But so perhaps, from, 5 alters, we can maybe hope to move on to 3, or, some change in that landscape. But getting better would require, again, destabilization of this into something else temporarily, and then hopefully it settles into a healthier regime, if you wish. And but some energy is again necessary to destabilize a pathological landscape. The difference, though, will be that it's gradual, voluntary, and healing-oriented. So it's a controlled, guided phase transition in therapy that takes a lot of time before the patient feels safe enough to try to do something about it, as opposed to abrupt, involuntary, traumatic phase transition. And the idea then is that after the destabilization, we want the system to settle down to something better with improved functioning. Now, we talk about phase transitions here, and what would that actually mean? And Professor Friston helped me, a couple years ago with this citation of your work with others about the hierarchy of coupled or interconnected attractors. And, we know about that with, sort of the story of generalized arousal, where subcortical structures, including the brainstem, they lead to the phase transitions of the cortex, where the deep phase is a nearly periodic system with some noise, and high gamma is a chaotic system with some noise, and you need a phase transition from one to another, all of which happens with the help of generalized arousal. And this is a wonderful paper that I utterly enjoyed by, Professor Friston and Chris Frith, a duet for one, about birds singing. And here is a slower Lorenz attractor leading to the phase transitions in the faster Lorenz attractor. I think you've mentioned about a 10-fold difference in time scale. And interestingly, subcortical neurons fire at about 1/10 the frequency of the cortical neurons. Moving on to clinical observations and studying from the most severe cases of the total complete wipeout, we can say that perhaps, I'm so sorry, not yet, dissociative disorders, such as DID. What clinicians most often talk about as the prevalent symptom, not necessarily pathognomonic, but prevalent, is emotional flatness or deadness or numbing. So not really alexithymic, but sort of like that, where the patient is very emotionally flat. And in our model, this corresponds to issues with communication from the core self up to peripheral self components. So then the autobiographical self in this regime operates as if it is uninformed by the vital emotional information flows that originate in the core self. And one of the possible ways this can happen in the brain is the inhibition from the prefrontal cortex of the limbic structures. But that's a very coarse-grained, very crude description, which has been updated by Ruth Lanius and other colleagues. So then at the higher levels of consciousness, we will perceive affects and emotions as less intense. Perhaps this can be described as the lowering of precision associated with affective prediction error messages. Now, again, the severe kind of total dissociations are the cases of general anesthesia. And this is sort of no self of any kind. And the recovery from general anesthesia is very interesting, as Michael Levin suggested, and other colleagues, is that not everybody comes back to being them from propofol. You know, some patients, particularly elderly patients, experience postoperative delirium, dissociative amnesia, postoperative cognitive dysfunction, and they may wake up as a pirate or somebody else. So again, it's not set in hardware. A seizure is another example of a severe but temporary collapse where, you know, a lot of things go out, not just the autobiographical self, but also the social and the bodily self, because the necessary resources for the functioning of the selves are dysfunctional temporarily. Moving on to permanent but more moderate levels of dissociation, the famous patients of HM and Clive Waring in England, who had hippocampal damage or amputation because of intractable epilepsy. They live in about 10 minutes of the here and now. You can meet and greet them, walk out of the room, come back, and they will greet you again as if they just meet you for the first time. And if you take the just descriptions of these patients and you give them to DID specialists without telling who you're talking about, they will, which I've done, tell you that these patients look perpetually depersonalized. There is no continuity of self, right? You can see the similar thing in Korsakoff patients who confabulate their past, and you can see similar things in Alzheimer's patients who have issues with recent autobiographical or episodic memories and encoding in Alzheimer's, retrieval in Korsakoff, but all of these cases are issues with discontinuity of the episodic memories. Moving on to moderate temporary cases such as substances, we know that ketamine, high doses of THC, ayahuasca, pretty much all lead to depersonalization and derealization. And at the level of correlation, not causality, these patients report a disruption in the sense of time, and certainly planning is impaired big time. So this is a temporal depth collapse. Another case is blackout in alcohol-induced blackout. If the person wakes up next morning, they have no idea what happened after 6 p.m. It's sort of a complete gap in the episodic memory, a discontinuity. And there's a version of that in acute PTSD. The said cases of students who saw a high school shooting. This one girl saw her classmate shot point blank in the cafeteria of the school. And some individual suggested to her days later to go back and, quote unquote, face her fears to go to the same cafeteria. She did, and she walked out, and she was completely unaware of what happened in the 20 minutes that passed. And this is what we call a traumatic amnesia that is not alcohol-induced, but a very similar, because hippocampus is flooded, you know. In dissociative disorders, you know, when we talk about complex trauma, then it's lasting stress beyond the agent's ability to manage, which leads to the disintegration of the self, where self breaks down into a collection of components, each with a smaller light cone. That is decoherence and discontinuity. And this is when the pathogenic attractor landscape takes root. And that is different from a single episode of drug use in which the dissociation is temporary. And because perhaps the resources necessary for the coherent integrated self are not quite there. Specifically, we think that with ketamine intoxication, working memory is pretty much out, and the patient is sort of psychotic. So that's a disruption in the self that is temporary. To summarize, the level of consciousness, the regime of consciousness, pathological states, and all the underlying resources necessary for the successful operation of each self component collectively influence the complex dynamics of the system. I will skip the neurobiology for the sake of time and to leave more space for the discussion. And going back to Casper, Hesp, and colleagues' paper, deeply felt affect, they have the simulated rat in a T maze, where they do 32 trials with food on the left and electric shock on the right. And Lenz and I thought about changing the second part of the trials, starting from 33, to electric shock everywhere. And the question on the table is, will rat remain put? And sort of, will it experience learned helplessness? In consultation with one of the authors, Ryan Smith, he suggested that it won't. This rat will continue to try to move and find out what's going on. So we need to change a couple of things. One, perhaps, is to create a bias against movement. Then when all the paths are epistemically and pragmatically the same, then don't move. Maybe this can be done through the C matrix, maybe something else, but also the confidence that they wouldn't move, the sort of hopelessness where, let's say 30 trials, you have seen nothing moving, and then update your predictions that it would not change. So then stay put. And this is perhaps the first phase to induce, learned helplessness when, the environment becomes very traumatic in a stable way. And the second phase where we'd like to get is perhaps the fragmentation of the self, which possibly can happen if it's not a T maze, but more contexts. And then there'll be fragmentations, the islands of episodic memory, and not the coherent one. And if we may, Professor Friston, we formulated some questions to you also, in addition to your comments. So what do you think about this temporal depth collapse? One option is the B matrices become an identity matrices, but perhaps the other one is structure learning, where the generative model contracts temporarily. Could there be other ways to describe that? The splitting or fragmentation of the autobiographical self. Could this be structure learning, specifically Bayesian model reduction, where some links in the model get cut? We would like to perhaps hear your thoughts on the modeling generalized arousal in the brain, where we need to update multiple matrices, top down at the same time. And finally, this is, if we look at the entire system in trauma, perpetrator plus the victim, which in some ways is similar to cancer in the body and the tumor and the body it invades. So will the free energy of the combined, the dyadic system, increase, stay the same, or decrease? What we know about cancer is that eventually it kills the body it starts in, so it kills the energy source. And in that death scenario, the free energy will increase. But until the system is alive, we don't know for sure. Perhaps the tumor free energy is minimized, the body that it invades it's maximized, but we don't know about the dyad. But we wanted to highlight that this idea that we're not necessarily talking about optimization in these traumatic experiences. We talk about effective storm damaging things. So we need theories of damage. And I am done. Thank you very much.
Thank you so much, Alexey, for your talk. There's a lot to digest entirely for the people that are maybe not strictly familiar with your work, but super interesting, like lots of things, lots of point in common with other disciplines and how that can be formalized under the FEP or active inference. So yeah, very cool. So now we'll move to the Q&A discussion. So if there are like any questions or comments in the chat, like please raise your hand. So I have just like one general thing related to this. You were mentioning at some point how these disorders could be related to some sort of like limited capacity, maybe in the genetic model. And I think might be related to one of the questions you put at the end, in which you say, oh, maybe this can be related to how you are like constraining or reducing the generative model, right? So I was thinking whether this kind of limited capacity or constrained model, like, could you see like in different, like in two different sides? One would be like effectively reducing the capacity, like cutting like some bits of it. But couldn't it be, or I wonder how would that like affect if instead the generative model is not affected, but you have some sort of constraint in the inference that you can do over that generative model. Like you have like very limited time, let's say, to do inference over that model or something like that, where that could be considered as well any type of limitation or constraint that could lead to something related. Oh, sorry, you're muted.
Very interesting, Miguel. I don't know. I haven't thought about that, but that's a very creative thought. My impression, and I really don't fully understand structural learning and Bayesian model reduction, I'm working on it, but my impression is that this is an optimization where the pruning of the model happens to save some resources. So it's a sort of an optimal move to kind of prune the model and make it more efficient. In a way that happens when children learn and they automatize a certain skill like reading, and it kind of moves from more frontal to more posterior areas, or in adolescence, the connections get pruned and the model becomes faster and more efficient. And we're wondering about a slightly different scenario where damage happens, where there is an influx of energy from the outside. So it's not necessarily the optimal move, and certainly constraints, a ton of constraints in trauma. But I don't know exactly how to translate this clinical language into what you've mentioned here. So.
Yeah, so you were mentioning like explicitly like pruning. There would be like some sort of pruning in that model, right?
Yeah.
Yeah. I was just wondering whether if there's like working under some constraints of information processing,
Right.
that could be related to the kind of inference that you can make, or how limited your inference is going to be over that model, something like that.
Yeah. In trauma, in complex and acute trauma, the cognitive capacities are limited. There's issues with working memory. There's issues with attention. There's episodic dysfunction in DID, so it's not functioning the same way as it has been before. So capacities are different. The underlying capacities necessary for the functioning of the system indeed change. So.
Okay, cool. Thank you. Lance?
Hey, Alexey. Thanks, great presentation. I had a question, maybe you answered this already, but so when we have this sudden temporal depth collapse, which is clearly pathological, under what condition or conditions can we expect the temporal depth collapse to be reverted? And I guess to what extent?
Right. Do you mean clinically in life or statistically? Or?
Clinically.
Well, if we take, for example, the substance use cases, right? So let's say that there's a ketamine intoxication episode where the person is intoxicated and their working memory is dysfunctional and they depersonalize and dissociate and they cannot recall things or plan into the future. But then the intoxication subsides and the system comes back and corrects itself to normal. Perhaps they will have a amnestic episode where they would not remember exactly what was happening to them while intoxicated, but they will have restored the capacity for a coherent and continuous self. That could be one of the examples. Does that answer your question? Or?
Yeah, definitely.
Mm-hmm.
Yeah, I'm just thinking also in the context of structured learning. So if we think about this reduction in temporal depth as being an instance of Bayesian model reduction, where we just prune part of the model, then I'm also thinking in relation to the clinical work that you mentioned, how the growing back would actually happen.
Mm-hmm.
Because
Right.
maybe the time scales at which the pruning happens, how fast the pruning happens and how fast the growing again happens, maybe that actually tells us something about what the pruning actually is.
Very interesting line of thought, Lance. I think that perhaps, in order to restore things, one way of thinking is that it's, we need the damage to be reversible and not completely reversible. Let's say patient HM and Clive Waring cannot go back to a healthy state. That's a permanent damage. But, one of the things we do in acute trauma, and I am free associating to your very sophisticated question. So in acute trauma, there's a gap of a specific episode where, let's say, burglary or assault happened. And what happens is there's shards of glass. There is a phobic memory, a semantic memory, other kinds of memories, but not a coherent episode. There isn't a stable episodic memory of the acute trauma. It's not encoded because hippocampus is flooded with cortisol. And that's a gap in autobiographical memory. What we do in therapy, not immediately for sure, but at some point after the patient has reached stability, is we fill in the gap. We construct this episode together from these shards of glass, and it may not be exactly accurate, but at least we restore continuity. Does that kind of relate at least to what I asked? Yeah. So.
Yeah, but it's definitely quite complex.
Yes.
I think that was also one of the themes of your presentation: the modeling on the one side and the clinical work on the other, and so it's very tricky.
Yeah.
Well, I'm sure Carl and others will have lots of ideas, but it's very tricky to make them match in a meaningful way.
Which is why we want to start with rats and teammates.
Yeah.
More manageable.
Thanks.
Thank you.
Cool. I think Daniel has a question as well.
Thank you for the presentation. A question arising while this was happening was like, what kinds of experimental paradigms for a human or for an animal model, like, do you think that these kinds of assessments would require self-report? Like, who was it that was having a memory 30 minutes ago? Or who was it the you that was feeling this way this long ago? Or is it even something that with like a classical multi-arm bandit, like, would you rather have one ticket for this slot machine now, or would you rather have one ticket for this slot machine in 30 minutes? Like, do you think it's something that can be a temporal depth assessed with an economic paradigm? Or do you think that the self-report is where, or other ways to assess?
Right. Thank you so much for this question. We planned a second paper in which we wanted to present the evidence of, this temporal depth collapse happening in different kinds of episodes. And there are indeed measures of clinical evaluations, not necessarily just the self-reports, but other ways to look at it. Specifically, there's different ways we assess time. And sometimes there's a sense of how fast the time is flowing. And in substances, it does indeed change. Some individuals say that they smoke, marijuana to slow down the time. But this ability to just differentiate the past, the present, and the future has ways to be evaluated. And in order to even ask the patient something, they need to have some capacity. So with severe ketamine intoxication, perhaps they can't talk, clearly. Or, with now with the ketamine being very fashionable, when it's not Spravato, which is intranasal, but people do intravenous, they are, vomiting and they're fully out of it. It's not easy to assess them in that state. But perhaps with THC and other people have done these studies where they have done, let's say, fMRI, but in addition, they've been interviewing the patient and collecting measures to see their temporal functioning. And maybe with current users, we cannot do damage, so that IRB approves the study. But with current users, we can do these assessments. And what to do with simulated rats or in silico is perhaps we have more leeway. But I don't know if I'm answering your question, Daniel.
Yeah, it's interesting about the time perception and whether that's like sort of the metronome that drives episodic memory and economic assessments. Like if there's just a temporal coefficient scaling curve difference with different kinds of time preferences, or whether there's some other feature coming into play.
Mm-hmm. Yeah. To maybe illustrate what you're saying is, again, Lars and others are studying meditation very seriously and teaching it and practicing it. And I think what happens in meditation is they attempt to slow down because we're too fast for our own good, which is being lost in thoughts. And I see that, and it's very related with sort of patient experiences. When anxiety level goes up, they talk faster, they think faster. And you can't really just notice things until you slow down. So this slowing down perhaps can be correlated to being a bit more in the here and now. But that's again, there's multiple measures there, and I appreciate you bringing it up. But the depth is a different story. Is really having no access to the past and no ability to plan into the future. Maybe the extreme cases of patient HM and Clive Waring are the cleanest examples of that, where there's just really a shorter temporal light cone, and it cannot, in principle, to be bigger. And that is what happens to our generative model when that happens, and when it's sort of constricted by damage to hippocampus, right? So.
Oh, thank you so much for the questions. Let's see, I guess if there are no other questions or comments, we can pass it on to you, Carl.
Yes, Daniel and Lance have got their hands up. That's their legacy.
Oh, yeah, I think so. Yeah.
Very good. Excellent. Yeah. So extremely comprehensive presentation, which was very rich. And I imagine that most of this material has already been committed, if not submitted, to publication. So I'm just going to just focus on how one would substantiate this narrative with simulations. And I think the final focus on some numerical studies just to illustrate the underlying mechanisms are exactly the right way forward in terms of drilling down on the mechanisms that one wants to get at. Having said that, there's some really generic and fascinating issues that this broad coverage, this very inclusive coverage, tries to accommodate. What I was trying to do whilst listening to the presentation is just to drill down or winnow all the different perspectives and try and identify the core belief updating pathology that seem to be running throughout all of the examples and accounts of various aspects of depersonalization and derealization, and how that can be induced through trauma. I don't have a clear answer, but I think there are certain observations that may help just bring things in, bring certain things into focus and other things as secondary or sort of more peripheral issues. So just thinking about the generic aspects of dissociation or dissociative syndromes. I am mindful that when one talks about the application of active inference in computational psychiatry, very often the story starts with the psychopathology being an instance of false inference. And that provides a nice bridge between the mechanisms, the pharmacology, the neuroanatomy, the neuropsychology in the case of HM, and the beliefs, read as Bayesian beliefs, that underwrite the patient's behavior and possibly self-modeling. And the story would go that there are two types of false inferences, type 1 errors and type 2 errors. So type 1 errors would be falsely inferring something is there when it is not. And clearly that is an apt description of hallucinosis, hallucinations, and possibly delusions. So you are inferring on the basis of the sensory evidence an explanation which is not veridical or suboptimal in relation to that evidence of the kind that a statistician or the kind of error that a statistician would make in falsely inferring an effect of some treatment in the absence of any clear evidence for that. The more interesting false inference from a statistical perspective would be a type 2 error. And this is where you falsely infer something is not there when it is. And I think this is much more closely aligned to neglect syndromes and dissociation hysterical syndromes that I think you could probably put derealization, depersonalization under, in the sense that the subject does not infer the correct cause of the sensations. Like, this image of me is not caused by me, it is caused by somebody else. And if you think of the potential mechanisms for this kind of, or these false inferences, but particularly the type 2 inferences, they can both be caused by a failure to estimate the standard error of your statistical tool or your statistic upon which you're basing your evidence. And in active inference and predictive coding, that reduces to the precision. So the standard error would be the inverse estimation of the precision. So what does that mean? Well, it means that you're looking now at a psychopathology that is associated with a failure to assign the right precision to various beliefs in hierarchical inference, which is nice because from the point of view of the pathophysiology, what you're talking about is a failure of neuromodulation. And if you're talking about a failure of neuromodulation, you immediately have a compelling link to the formulation of the core self as the reticular activating system, as the cells of origin of the classical neuromodulated transmitter systems that neuromodulate the responses of, say, for example, neuronal populations encoding prediction error, that mediate the precision that you assign to, in this instance, precision-weighted prediction errors. So if you assign too much precision, they have too much effect, or too little precision, then they don't have enough effect on belief updating in a hierarchical setting. The other nice thing about sort of focusing on precision and the synaptic mechanisms that mediate precision is that is entirely consistent with things that you mentioned, such as sleep and the different neuromodulatory mechanisms of different sleep stages. The other examples would be reference to, say, ketamine misuse, in the sense that all drugs of misuse and drugs that have a psychedelic or psychomimetic or psycholytic or psychoactive aspect that are used therapeutically, they all act upon neuromodulation, which brings us back to the encoding of uncertainty, or its inverse, the encoding of precision. So I'd be looking for an account here that could be cast in terms of a failure to infer or recognize the precision appropriate for this particular context. And that in turn relates very nicely to your you're showcasing these ideas in the context of deeply felt affect, because of course things like gamma are just one instances of precision. And furthermore, illustrating that precision is an attribute of any belief structure. So it's not necessarily just gamma, but it could be any, excuse me, it could be any belief structure in your generative model. And if you pick the probability transition matrices in discrete state space models, so now we're moving away from predictive coding and more to belief propagation under discrete state space models, then you end up asking, well, what would happen If I was unable to attenuate the precision of the likelihood mappings, Alexey, what I'm doing here, I'm aware this has been recorded. I'm saying this for Lance so that you can go away and get him to unpack it for you. So for Lance, what would happen if I now had to simulate psychopathology in terms of aberrant precision estimation? And I wanted to do this in the context of a partially observed Markov decision process model. And just for consistency with nearly 90% of other accounts in psychopathology, I start off with a failure to modulate the precision of my likelihood mapping. So this is the the poster child of this story starts with autism, that you are unable to ignore the sensorium. Alexey, you use the word attention. That's another perspective exactly on this encoding of uncertainty, or the encoding of precision of various sources of evidence for my belief updating that is underwritten by belief propagation, where the belief propagation depends upon the precision afforded various messages in the context of variational message passing of belief propagation. So let's imagine that we go for the canonical explanation, which is a failure to attenuate the precision of a likelihood mapping, which means that I am always attending to the sensorium. I can never attend away from or ignore anything. What does that mean in terms of the effect on my belief updating? Well, as I increase or fail to attenuate the likelihood precision, that has the effect of reducing the precision of the priors. What are the priors in a partially observed Markov decision process? These are exactly the B matrices that you highlighted. So what would it mean if I assigned undue precision, aberrant precision, to my likelihood mappings? Then that would look like, or it would have the effect of reducing the precision of my probability transition priors, or my B matrices. What would that do? Well, it means as I used these probability transition matrices to roll out into the future in the spirit of planning as an agent, that it is my future because I am authoring my future, because these probability transition matrices in part depend upon what I'm going to do. And now I've got a reduced precision, which means that uncertainty uncertainty accumulates more quickly than before. So what would that look like? It would look exactly like a loss of temporal depth. So in answer to your final question about does an understanding in terms of a change in the nature of the B matrices provide a unifying account, then I think absolutely yes. I think you got the technical detail wrong here. It's not B is an identity matrix. That's the most precise you can have. If you had an identity matrix in the sense that the next state is exactly the same as the previous state, you wouldn't have any interesting future. I think what you actually meant was that you're destroying any precise succession of events as you roll out into the future by reducing the precision of the B matrices, or the probability transitions. And again, perhaps Lance can just give you a little numerical illustration of that, or talk you through it, because I think that's an important concept which you need to get in the mind of the reader. That if you have a very diffuse, imprecise transition prior, then when you keep on reapplying it as you get deeper and deeper into the future, the probability mass diffuses, and you basically, everything becomes very foggy and uncertain very, very quickly. So that would be a natural and simple explanation for this loss of temporal depth. that simply inherits from a failure to modulate the relative precision of the likelihood and the priors in your hierarchical generative model. So I think that that would be quite a compelling account. And it's interesting to note that external, well, not external, but a lot of empirical evidence points to different neuromodulators as setting the tone for the likelihood mapping, the priors, the transition priors, namely the A and the B matrices, and usually acetylcholine is usually associated with the likelihood mapping on the sensory precision, while norepinephrine or adrenaline, which is exactly the the sort of the classical neuromodulator associated with arousal and so pupillary dilatation, all of that, all the ways that one could measure that, is usually associated with the precision of the B matrices. So that, I think, provides a quite a compelling link, because on that view, you would expect a tight relationship between the loss of temporal depth that depends on a loss of the precision of your priors that would be associated with noradrenergic discharges in a situation of arousal, where you're now focusing more on the sensory evidence at hand, in, say, that you're experiencing some trauma, where your prior beliefs about what's going to happen next are no longer fit for purpose, and you know that, and you recognize that, and thereby you increase the precision of your likelihood mapping and attend to what's going on in the moment at the expense of not being able to plan deeply into the future. So that's a very consistent story, but what that story does not cover is the kind of precision you were talking about with deeply felt affect, which is the precision not of beliefs about states of affairs in the world as they unfold, but beliefs about my policies or my plans or what I'm going to do. And that's where the gamma comes in. So there's a third precision or third posterior belief, which is about me as an agent. And that also has a precision. And interestingly, if you lose precision over the B matrices, then you're likely to also lose precision about what to do next. And therefore, all of these different kinds of precisions do interact in an interesting way. But let's just stick to the key point here, that we can have precisions about our likelihood, we can have precisions about our priors, about the way that the world unfolds, and we can have precisions about our policies as an agent in that world, as a self in that world. And I'm just wondering if that divide between derealization and depersonalization could usefully be aligned with a loss of precision about the B matrices, which is states of affairs in the world, so this will be derealization, as opposed to the special thing about depersonalization. This is no longer me. It's all about me, and that may be associated with a loss of precision about a loss of confidence, if you like, about what I am actually doing, me as an agent, what I'm actually doing. If we look at this posterior over policies as basically an inference of an inference about what I am currently doing and what I'm likely to do, next. So that may be one useful way of unpacking the basic notion that precision is not, there's not one monolithic precision. You have precisions everywhere, and you have to think about the consequences of changing precision somewhere on the precisions elsewhere, and the different manifestations that you would get with those losses of precisions. Just to note, I don't think you need to invoke Bayesian model reduction here. It's not a question of throwing away B's in the future. The B's are used recursively. There's only one B. It's just applied to itself multiple times as you go into the future. So you'll get if you like, a shrinkage of temporal depth for free just by reducing the precision of a given your B matrix. You don't need to worry about changing structure learning or changing the structure of the model. You just need to worry about the precision of the B matrix. So that would slightly simplify the story. What we haven't touched upon yet is the sense of self and attribution of selfhood. I think a key point which you were bringing to the table, that the notion of depersonalization is a failure to recognize that I caused that, which immediately I think speaks to something which you've spent some time elaborating on, that self is a construct. So from the point of view of modeling, that basically means that there has to be a hypothesis that I caused that. But you can only have that hypothesis if there's an alternative hypothesis that I didn't cause that, or that you caused that. So that immediately brings to the table a key architectural feature of the models that you were showing due to Caspar Hesp and Lars Sanford-Smith, which is this hierarchical metacognitive model, where at some level there are latent causes or explanations for the sensorium that have an explicit I caused that, you caused that, I didn't cause that, whatever, however you want to carve nature at its joints. And the very fact that you can recognize that you didn't recognize yourself tells you immediately that you have a hypothesis that sensory input can be caused by you or not you. And I'm wondering whether that would be a useful way of then understanding depersonalization, in that I'm now no longer absolutely sure that I'm causing the sensorium. So normally we're always in the flow of a certain kind, with quite precise beliefs about our plans and our counterfactual narratives as we go through life, never rendering the hypothesis I cause that the most likely and very precisely so. But imagine what it would be like if the alternate hypothesis I didn't cause that now attained an equal weight to the hypothesis I did cause that. And of course, this is just a loss of precision over the hypotheses of attribution, the hypotheses that you bring to the table to collectively, in a coherent way, to use your word, subsume everything under a really simple hypothesis. I cause that. I am authoring my sensorium. So this is when I said I haven't got all the answers to your questions at this point. I'm trying to think, would that be a simple consequence of losing precisions over policies, where the precisions themselves are conditioned upon I cause that or you cause that? So I'm just trying to think what would happen, and perhaps this should be the basis of your simulations. If I have an alternative hypothesis that you or I could cause something, and that basically means that if I cause things, then I'm in charge of the probability transitions, and I can pick different policies. But if you're in charge of it, then I can't. But if they've both lost precision, it may be that I cannot disambiguate now whether you caused it or I caused it, because the precisions of, or the confidence that certain things will ensue, is just generically low, and that might compromise my ability to infer agency, to attribute agency to particular sensations. I don't know, but that might be one way of getting at or scaffolding a numerical simulation, which I think has to go beyond a rat in a T maze. You need to equip the rat in a T maze with theory, with a minimal selfhood, which just basically means your rat in the T maze has to have a higher hierarchical level that has at least the hypothesis, I did that, or I didn't do that. And then it has to be able to now infer, yes, I'm causing this is going fine. Or no, something's happened. And in fact, I'm not causing this. Something else caused this. But you have to actually write that down into the model. So you have to equip the rat in the T maze with a hierarchical depth, with this simple hypothesis, it's me or it's not me. And then operationally, what that means is you can now condition the precisions appropriate for me versus not me. And that means that you can start to write down generative models where if I'm causing stuff, I can basically ignore the sensory consequences of the consequences of my actions at the level of sensations, and this would be called sensory attenuation. So this is a well understood psychological and psychophysical phenomena that when I believe I am causing my sensations, I effectively attenuate the likelihood of precision. I ignore the consequences of my action, and get into the famous. That's why you can't tickle yourself, because I'm doing the tickling. Through to sort of all the empirical evidence for sensory attenuation. So if you could equip a mouse model with the ability to recognize, yes, I'm now in charge of my locomotion, and therefore I am now going to assign more precision to my prior beliefs about the consequences of my action in the B matrices and less precision to the likelihood matrix, then everything should work as normal. And that's basically what as normal. What I mean by as normal is the current simulations where there is no alternative hypothesis. The rat always assumes it is in charge. Whereas if you now have a more elaborate, a deeper rat that actually has a sense of self or minimal selfhood, you've now got an alternative possibility now to rewrite the B matrices and the A matrices or their precisions as if someone else was moving them, as if something else was causing the sensations, not me. And you could start to think about, well, how could I now cause the mouse to jump from the default hypothesis, it's me, to it's not me? And that could be a traumatic, unexplainable intervention. And I think your interesting comments about the or hypothesis that you get this fracturing, and you call them alters. So I should ask you, but I'm in the middle of a stream of consciousness, so I'm not going to bother. But I'd never heard of that before, and I thought it was really nice. And I assume it's some kind of alter ego or alternative attractor, and it certainly does speak to this sort of multi-stable or multiple local minima in the free energy landscape. And if I am traumatically moved from my global minima to another local minima, which could be I didn't cause this. Everything I see and hear and feel is not caused by me anymore. And I now need to find out what's going on. It may be quite difficult to jump back again. You get these sort of, and of course this can then be generalized. It's not just me versus not me. It's me as this type of thing, or it's me as that kind of thing, or it's you, or it's an unreal me, and you have multiple alters around. And these alters, these minima in the free energy landscape, the Waddington landscape, for belief updating and self-modeling at this level in the hierarchy, can now be populated with these different local minima that are just the from the point of view of the modeling, they're just the different states of me or not me that would correspond to the belief space at the higher level, and then what you're hoping is that that a recovery from that would involve a return to the default it's me with a high precision. But if you can't get that precision back up again, or that temperature back down again, you may well be perpetually uncertain about whether it's me. And then, just to use your therapeutic perspective, the job then is just to reduce the number of local minima and try and get some precision back over at least 2 or 3 alters, as opposed to the default or the original state of 1 alter. So you won't need to actually write down attractor landscapes explicitly, because you'll get those for free with just the discrete states of meanness in a Markov decision process model. But you can argue that this plays a role of multiple states of being, multiple alters. You just have to write them down and think about what they could look like, and then examine the implications of traumatic intervention in terms of destabilizing a precise belief it's me, and providing evidence for an alternative hypothesis, say it's not me, and then see by switching on learning whether there can be a recovery after the traumatic event or not, or whether there's some kind of hysteresis in play. I don't know what that's going to look like, because it's never been done before. But what I do know is you're going to have to explicitly write down a second level in the hierarchical generative model with these self-related hypotheses, or self-non-self hypotheses, as part, and work out the message passing that basically solves the problem of what evidence do I have that I am causing this. And the only evidence you have is that the world seems to be unfolding under the transition matrices that I a priori inferred when I'm doing my policy planning as inference. And I'm not sure what the messages would look like. Well, in fact, I do know what the messages would look like, because this is just vanilla hierarchical belief propagation. But I'm not sure to what extent those messages will depend upon the precisions. So I think that's something you're just going to have to work out with Lance, using numerical studies. If it helps, I've just got a few papers that you might want to start off, which I'm sure you've come across before, but if not, then it might be useful to. And then I'll stop talking and then pass it back to you and Lance for questions. So it strikes me you want to start with something like this, which is Adam Linson's work on responses to stress. The slight problem with this, although it's nice in the sense that it does have a minimal hierarchy, but it's not good enough for you, because it doesn't actually have a deep hierarchy where there's a level above this of latent states with me, not me, you, Godhead, whatever you want to, all the alters. You need the alters, alter 1, alter 2, alter 3, alter 4 up here. And then these C's and G's and B's and A's are now all conditioned upon the alter that you're in. And because you'll now have different effective B's given the particular alter, they will have different precisions, and now you can talk about the precision related story, and indeed you can probably engineer them so that the A's and the B's have the same shape, but just more or less precise depending upon which alter you're actually in. So this was an interesting, the other reason I like this or recommend this as a starting point, that it actually put interoception explicitly into the model. So it's more than a mouse trying to find resolving, explore, exploit. There are certain explorative information gain aspects, epistemic affordances, and utilitarian or instrumental aspects to it. But in addition, there's an explicit interoceptive part of the model. That may be useful for you if you actually want to think about me being embodied and actually being aroused physiologically. You may want to put that in. But this is not going to be the answer. The answer you're searching for will require, you have to put your alters in the model to actually do what you want to do. So, but anyway, it may be a useful starting point. What's this one? I don't know. I put this up. I don't know if you've read it, but it just struck me that another narrative account of more general psychopathology, coming back to Robin's work, was explicitly cast in terms of the stability, i.e. precision, of landscapes of the kind that you were referring to in terms of, say, different alters down here. And just thinking about the learning of these minima, and so this wasn't intentional in the presentation of this diagram, but you can imagine before a trauma, there's just one hypothesis, everything's me. But after a trauma, you've got a number of options that you have to decide among. So these would be the alters here. And the particular issue that Robin was interested here was the notion of canalization in just the experience from the past to the future, carves out this landscape very much in the way that a river carves its own riverbed. So you can learn more and more precise beliefs, and the precision here corresponds to the curvature of these alternative ways or states of being. And sometimes you can literally get stuck in a rut. And that's basically the story of this canalization notion of psychopathology, that you dig your own riverbed too deep and you get stuck there because you're overly precise. And then, and if the world changes and you don't change with it, then that can be very problematic. So, the response to trauma in terms of the loss of temporal depth and the effective loss of your prior precision is exactly to broaden this landscape so you can explore and accommodate changes in this new world without your loved one or having been sexually abused or having to re-engineer the contingencies and the cause-effect structures in your world. I don't think it's practically going to be of great use, but I thought it might be a useful nod to the notion of canalization, in the sense that precision gets into the game as basically the rate at which you can recanalize or decanalize, and this is very intimately related biologically to the notion of neuroplasticity and plastic potential, and then there's a lot of interesting psychopharmacology between the role of certain drugs, say 5-HT2A agonists or ketamine, not in terms of immediately resetting the precisions, but in increasing the learnability over longer time periods through having a sort of a plasticity effect in the longer time scale, possibly involving things like steroids. This paper I just put up there because it's got a nice table. If I remember correctly, it had a nice table. I thought it had a nice table. I can't find it. Right, it doesn't. But anyway, this is just a nice summary by Thomas Parr, assigning different classical neuromodulators that Mark Soames would associate with feeling, associating different neuromodulators with the A, B, and C matrices that we've been talking about, where C gets into the policy through the the prior preferences, and he actually parameterized these literally with the precisions of different matrices. So if you wanted references to the different neurotransmitters involved in arousal or attention, then this may be an interesting point of reference. It also reminds me to say that I like this notion of, which Mark Soames would also like, that the core self can be associated with the actor of, or the inaction of, precision control, basically deploying mental action in the form of attention to different parts of your brain or different parts of your planning. Whereas the extended self, the autobiographical self possibly, and the narrative self, as opposed to the bodily self or the somatic self, was in the cortex, because this is very much how Mark Soames resolves his arguments with cortex versus subcortex debates. The actual source of feeling, in the sense of enabling message passing through broadcasting modulators that enable belief updating through picking the right precision of various messages or mappings, depends upon input from the cortex. But there's a circular causality that the core self also informs the cortex. And I liked at one point you were sort of implying that circular causality between the cortical narrative self and the core somatic self can be broken and dissociated if the core doesn't talk to the extended cortex properly. So what would that look like? Well, it would simply mean that the neuromodulators emanating from the reticular activating system, for example, for the Raphe system, if it's 5-HT, or the nucleus locus coeruleus, if it was the noradrenergic, or nucleus bizalis, if it was the cholinergic system, what that would look like for someone who was a neurophysiologist would be that there is a failure of neuromodulation of the cortical level, which is precisely the failure of precision control that we were talking about. So a failure, say, of sensory attenuation. So that notion that if there's a disconnect or a dissociation between the implementers of the core self generating the signals that ignite or enable precise message passing in the cortex, including the hippocampus, then that would be exactly the kind of pathophysiology that people bring to the table when talking about a failure of precision weighting, say, of prediction errors in predicted coding formulations, but more generically, a failure to encode and deploy precision or uncertainty. So that it struck me that that was an inclusive and accommodating account that would certainly please a lot of people, particularly Mark Soames. So what am I doing here? Oh, yeah, this story is my usual review, just highlighting the explanatory scope that you buy into. Oh, it doesn't have the... you buy into if you just frame your account in terms of neuromodulation, attention, or precision or uncertainty encoding. And this paper has over 200 references, all of which speak in one way or another to psychopathology mediated by a pathophysiology of a neuromodulatory sort that can be read as a failure to encode certainty or precision in the Bayesian brain. So that's that one there. That's good. And we've done that one. Excellent. So we get rid of that one. Had we done that? Was the Thomas Parr. Just to remind you, and certainly epistemics and active inference with Thomas in the Royal Society. Oh yeah, I haven't read this, but do you know Jeremy Holmes? It might be interesting just to read some his work. I mean, he's an expert in attachment theory, but also I think aberrances and failures of attachment theory as read through active inference. There might be an interesting convergence with. So he's a UK expert and author of several books on sort of neuropsychoanalysis, but I repeat, with a special focus on attachment theory. And I think he does talk about dissociation, dissociative syndromes and the like in this little review here. But the reason I put him up was more for the books that he's written on themes which might touch upon your interests. Yeah, I'm sure you've come across this. There's a new person on the scene, Darius, who likes flow, and I'm not sure that you can reconcile this account with his interpretation of loss of temporal depth in flow. But it may be an interesting exercise should you want to. So that's hypothesis and theory and frontiers. Yeah, I'm just putting this one up just to remind myself. This Strange Things paper about the remind myself about the sort of the bright line between agents that can have a sense of selfhood and things that can't. I can't remember what was the example you gave, but you certainly sort of drew a distinction which may be of a vague or graded sort between things that can and cannot plan into the future. I would be more emphatic about that. I think, from the point of view of the free energy principle and the natural kinds of things you can get, as soon as you get something that is sufficiently big and multicellular and has blankets within blankets in play, the action on the periphery of this Markov blankets and Markov blanket structure no longer has access to the inside, so that the action now becomes a cause of your sensations and therefore has to be inferred. And as soon as you get to these structures, as soon as you get big enough, then you have this opportunity for planning as inference. And I think only then do you need selfhood, because it's only agents that authentic agency really implies that the agent's generative model entertains a generative model of the future of consequence of their actions. A thermostat, I don't think, would need a sense of self simply because it can't plan. But as soon as you move into the world of deeply structured self-organizing systems that have a multicellular aspect, you then buy into a description or interpretation of such structures where the periphery, the action on the rest of the world, now becomes a cause of the sensation. And when that happens, I think you get true agency. And when you have true agency, I would submit that would be a necessary precondition for being an agent, and a precondition for being an agent with a sense of self or called selfhood. As I think you should emphasize that small things can't have this. You do need to have this sort of sequestration or separation between your actual real actions on the world and your model of your actions upon the world. And you can only get that if you can't see your actions. And you can only get that if you're sufficiently far removed from your actual muscles or autonomic reflexes. So you have to be multicellular. You have to have inner screens, as Chris Field would put it. Right, that's my stream of consciousness over. Back to you.
This was very useful, and I have to watch it slowly and digest a lot of things. And I wanted to maybe run back a few things. I did, I think, to some level understand your proposal, and it's so if we go back to your thought about we build a higher level in a rat and a T maze with two hypotheses. I am causing these things, or I am not causing these things, as the initial state of the system. And perhaps in the future we can say, there's more than two options. It's not I or not I, but there's sort of like 4 or 5 options, which is alters, or Frank Putnam calls them states, multiple options. Did I hear you correctly on that?
Absolutely, yeah. You could even sell it to the reader as basically building a split personality. You just build 2 rats, but now you combine them with one overarching state, which basically means it's rat 1 or it's rat 2. And then your job, the rat's job, is to recognize, am I rat 1 or rat 2? And rat 2 is non-me, and rat 1 can be me. But as you say, it could be, if you just build the A and the B matrices for 2 or possibly more kinds of rats that have greater or lesser degrees of autonomy or control of their environment, you should be able to engineer this. I say, when I say you, it's going to be Lance, I think, that's going to actually have to do this. But you should be able to engineer that quite simply using PyMDP, or certainly the MATLAB code will handle that, the most recent versions. And I don't think anybody's ever done this before properly. So a lot of the work, like Lars Sanford-Smith's work, has lovely figures, but he never actually simulated these things. So I think you're in a uncharted territory in terms of numerical studies.
It's really lovely to hear that it's not particularly trivial. And I think we have a sense of direction. Certainly, I'm nowhere close to understanding, and I'm very grateful for what you said and the fact that, Lance and Lars and Ryan share their views. I'm just learning. I'm a student, and I'm very grateful for their help. Wanted to ask you one thing to clarify, and it's so you've mentioned noradrenaline. Let's say it's increasing, which will lead to my likelihood matrices becoming sharper. I am more in the moment. And that influence of, perhaps I am attenuating sensory precisions less. I can't not attend. I must attend right now. I'm hyper aware. That will cause the decrease of the precision of the B matrices, which naturally leads to some contraction of the temporal depth. Did I hear you right on that?
That's absolutely right, yeah.
Okay. And then that may trickle further upstream. So if the B matrices are less precise, then that could possibly influence the gamma?
Yeah, so if you imagine the gamma basically reflecting how confident you are in disambiguating 2 or more courses of action that are based upon the accumulated expected surprise or free energies that are out into the future. If very quickly you accumulate uncertainty, then all of the competing courses of action are going to have roughly the same expected free energy. And that means you're not going to be so clear about where to go next. So you're going to lose precision. You're going to be in a state of angst. It's going to have negative valence because you just don't know what to do next. So not only will you be attending to the environment, it'll probably be associated with a negative affect. But to do that, you're going to have to put, if you want verbal reports of affect, you're going to have to put that emotional inference into your model. So your alter states could also have emotional labels. So it could be me frightened, me embarrassed, not me, unreal me, depersonalized me, and all of these things. Now you have to think, well, what does it mean if I was depersonalized me? That would mean you have to think what it would mean for the generative model. So yeah, it's that sort of percolation or influence on one precision on another precision, which is sometimes difficult to intuit, which is why I would be very much encouraging of numerical simulations just to test intuitions about what might happen, because it can be sometimes it can be counterintuitive what actually happens.
Do we have the time to ask a few more questions, or we must end? Or...
I'm fine.
Well, thank you.
I have to go just now, but thank you so much for the discussion, Carl and Alexey. This was really interesting.
Thank you.
Yeah, I'll catch up with you.
Thank you.
Bye-bye. Thanks.
Yeah, wanted to clarify perhaps our less ambitious project and a simpler experiment, Carl, with learned helplessness. So let's say a rat in a T-maze. Let's say we're not doing depersonalization just yet with the alters, and the Ryan's comment that if we take deeply felt affect and just put electric shock everywhere, it still would not work. So if we were to get to the point of the rat, so if we update the C matrices perhaps, and just saying, if you have tried many times and all the paths are pragmatically and epistemically the same, then don't move, put a bias against action in there, which I think corresponds to biology, because biological agents, if they lose hope, if in their deep depression, they stop moving, right? So then, yes. Is that the right path for that sort of simulation, just to put a bias against movement and to somehow engineer that, let's say, hopelessness, where you've tried 30 times and you're still getting electric shock everywhere, stop trying?
Yes, yeah, absolutely. And I think that Adam Linson paper actually used that. So this would be a sort of freeze response. Mm-hmm. So if you don't know what to do, you just freeze. So this would be the default policy. And you just implement that by having innate priors in the E vector. In the absence of any information due to the planning, due to, so if you like, deliberative evaluation based upon the expected free energy G, you just do the E, which would be nothing. It'll be a freeze response. I mean, doing nothing is actually quite difficult. So you have to have a good reason to do nothing.
You've mentioned E mattress, not the C mattress.
Yeah, well, yes, I think if you can't see the C, if you increase the precision of the C matrix and you make the C learnable, that will have the effect of changing your beliefs about the consequences of your actions in terms of the preferred outcomes. But if you're asking, how would I respond to a situation in which all bets are off and I know nothing, I was thinking that the learned helplessness is really nothing I do makes a difference. Mm-hmm. Now, if nothing I do makes a difference, that literally translates into an expected free energy that's the same for everything, which is the ultimate uncertainty, high entropy belief about policies. And if all the expected free energies are exactly the same, so nothing I do literally makes a difference in the expected free energy, then that the only thing that sort of then can get in and specify what to actually do would be the baseline E matrix, which would be your habitual prior. Yeah, but you're right. I mean, you could attenuate the differences by reversal learning paradigm. The active learning paper showcases that. So you could start off with prior preferences that the animal thought it was going to get a nice reward in this when it finds its reward, but then you reverse contingency so that now it becomes aversive, and let it learn that, and at some point you may induce a kind of learned helplessness as it does its reversal learning. But I think the simpler way is just to literally interpret learned helplessness in terms of nothing I do makes a difference. So what does that mean? Everything I do has the same expected free energy. It has the same epistemic value, has the same expected surprise. And therefore, I'm now going to revert to my prior innate habitual tendency to do nothing, which is to freeze basically. And of course that is associated with with a rather negatively valenced kind of state if you put in emotional alters on top of that. That's the sort of, from the point of view of the deeply felt affect, that is the basis of effective inference. It's just the confidence I have that about what I'm going to do next, and that confidence is a direct expression of the belief what I do next will make a difference.
Will make a difference. So this is the engineering of hopelessness. I'm just trying to digest what Ryan mentioned is, let's say we do 32 trials and there's electric shock everywhere, then the rat unfortunately would continue to try to get out. She's, what if things changed anyway? So how does it get convinced? How do we go from, the default of having some hope, try something, what if it got a little bit better, to stop trying? How does that get engineered, that it becomes convinced that nothing, and actually stops moving and stops trying to get to other places?
Yeah, I think that's a slightly simpler problem. The rat will just find a safe place where it doesn't get shocked. It'll just stay in its starting position or hide with the instructional cue. That's much easier. That's much easier to simulate in the sense that if you just punish everything apart from staying in the initial condition, then it will eventually work out precisely and be quite happy with that once it knows what to do. I just stay where I am. But that's not learned helplessness or hopelessness. That's just basically realizing that's agoraphobia. That's sort of so. But as long as you allow the person to stay inside the house and avoid those adversarial social interactions, they're perfectly happy. Thank you.
I think. Yeah. Oof, I would have to read all these papers and digest, and I'm most grateful. This is so generous of you. Thank you so very much, and I'm very, very happy. And I've heard the word wrong about which is nice and humbling for me. I need a dose of humility, and I certainly understand very little, but it helps to have this mathematical clarity, because psychoanalysts don't use this word right and wrong. They're just saying, well, so. I really appreciate that we don't need to go to identity, and just concentrate on precision. And it helped me a great deal to realize how they're interconnected, and that just the update of the likelihood when it stops doing sensory attenuation will in fact lead to the beam matrix behaving as if they are less precise, and etc. So that's all interrelated. And what you said about agency is lovely, because we use it quite a bit in therapy, the sense of agency. And I've never made that connection that you just made between dissociative experiences and the loss of the sense of agency, of course, but just that kind of explicitly code the agent and not agent, and saying, because we have patients who don't depersonalize or don't dissociate, they're just in a passive state. It's all the wheel of higher power. Why, it's just nothing depends on me. Why try anything? Let me play my video game. I don't know if that's a kind of depersonalization, but they are the same John, but they're just, John is doing nothing. They're passive. So, yeah.
Yeah, well, I think that sense of agency is an important concept. And that all I'm saying is that if you want to really sort of formalize this mathematically, you have to put a sense of agency into the model, and that's just the alters.
Okay. Thank you. Thanks a lot. Yeah.
Now, Miguel is going to make us clap again.
Well, thank you so much, Alexey and Carl, again. So yeah, let's clap for an amazing presentation. Thank you so much.
Thank you. Thanks a lot. Thank you.
Thank you, Carl, for your feedback as well, as always. So I guess see you everyone next time.
Thank you.
Thank you so much. Bye.
Thank you. Bye. 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 Thanks.